Well, welcome back, folks. Dr. George Salib is here, and he is the owner of Orange County Eye Institute. And welcome back.
Thank you.
Nice to see you again.
Nice to see you.
And you're talking about something that affects a lot of people, dry eye disease. And as we were talking during the break, I was not aware that it was an actual disease. I thought it was just a temporary condition due to maybe an illness or the pollen or something where you get something in your eye for a while. But this is really quite debilitating. What am I trying to say is it could be really affect somebody quite a bit. I mean, the constant itchiness and what is dry eye disease? What causes it?
Well, the basic idea is that an eye needs to be lubricated in order for it to see well and in order for you to feel well. So the natural lubricating system for the eye are your tears. And the tears are produced by the lacrimal glands, which are these little glands that are found beneath your upper eyelid. This is a typical picture of a person with dry eye disease. And other components of the eyes can also produce tears, such as the whites of your eyes, which are called the conjunctiva, and even the eyelids produce oils that lubricate your eyes. And if your eyes are not adequately lubricated because either the production of tears is inadequate or the quality of the tears is inadequate, then you develop this chronic inflammatory condition of dry eye disease, which can lead to a bunch of dry spots on your eyes. It can lead to increased rates of allergies because the pollens love to stick to the very sticky, dry eyes.
Right.
Does
it make your eye feel like if you were to rub it almost pasty in a way? Would you feel almost mucousy?
Mucousy is one aspect of dry eye disease. A lot of people just have irritated eyes.
Okay.
For instance, they might feel like something's inside it, like an eyelash, eyelash or sand. That they might feel gritty. But one common thing about dry eye disease that people don't associate with dry eye disease is that their eyes actually start to water. And that's because, yes, it's an actual reflex mechanism. When your eyes feel dry or get dry, then the eye will reflexively produce tears in order to lubricate itself. So watery eyes, itchy, dry, burning eyes is a hallmark of dry eye disease, as well as fluctuating vision. For instance, if you're trying to read something and you're doing fine for a few minutes, and all of a sudden after 10 minutes you just can't read anymore because it's blurry, and you blink a few times, it gets a little better, that's a sign of dry eye disease as well.
Now, how does one know if it's just, a lot of us, including myself, this time of the year, as we get into the springtime, the pollen count goes way up, that we're not just having a temporary temporary episode due to all the pollen and environmental effects. Would this be something that is persistent over several weeks or a longer period of time?
Yes, in fact, dry eye disease tends to be something that will persist all year. It can get worse in certain times of the years. Now, around this time, we might also start to deal with allergies, which is a separate process, which, they kind of go hand in hand, but with the pollen counts being high, people will start to feel more itching, and that tends to be a more seasonal thing in general. But dry eye disease is something that will persist all year round.
How common is it, and at what age group can this affect even people that are in their 20s and 30s all the way up, or as you age, is it a little bit more common and becomes more persistent?
It's actually a very common problem in our society. It does tend to affect older people more often as your tear production decreases, but it can affect anyone. And depending on what study you look at and which one you believe, the numbers of dry eye disease patients are really staggering. Anywhere from 25 million up to 90 million plus people in this country alone suffer from dry eye disease. And most of them have been using tears for quite a while. In fact, about half of them have been using tears for about 3 years or more. And it's one of the most common reasons that people will come in to see their eye doctor. In fact, about almost half of all eye visits tend to have dry eye disease as one of the main causes for bringing them into the eye doctor. And interestingly, not everyone actually tells their eye doctor about it because they don't appreciate it, that they have it, or they don't value it as being something that really affects their lives.
Now, what are some of the causes? Now, can this be caused by the environment, that somehow your eyes are getting infected, they get this disease? Can it be caused by certain illnesses? I know a member of my family several years ago, she got Sjogren's disease, which is, of course,
Right.
Autoimmune. It dries out all your systems, but her first symptoms were constantly itchy, dry eyes. And then from that point on, it took a few months to figure out what it was. But are there different reasons for this to come about?
Yeah, you're absolutely right. There are many things that can cause dry eye disease. Age, of course, is the most common one, as we had talked about. Certain environmental factors like the Santa Ana winds, whenever they pick up, people tend to feel more dry. People with certain autoimmune diseases, as you said, you mentioned Sjogren's, which is kind of the trio of dry eyes, dry mouth, and arthritis. So if
Right.
you have those three things, definitely go to your general doctor to have them check that out.
Yeah.
Thyroid disease also is one of the autoimmune diseases that can cause that, as well as rheumatoid arthritis. If you take certain medications, that can also cause dryness of the eyes. When you take those antihistamines for the allergies or for your
Right.
colds, that can lead to dryness, or certain antidepressants or blood pressure medications can also do it. And certain surgeries, if you've had LASIK eye surgery, like laser eye surgery, that is one of the things that can trigger dry eye disease.
And once you have this, or you're feeling the symptoms of it, are there certain things, we'll get into the treatments for it, but that someone can do? Are there certain things that people may do that make it worse? Obviously, don't be going out when it's windy outside, that sort of thing. But are there other simple things they can do beyond the treatments to help out, or not to do?
Well, there's certain practical things you can do. For instance, if you're suffering from dry disease, you can put a humidifier in your room so that it humidifies the air. Try not to sleep with a fan or an air conditioner or heater blowing in your face. If you use a CPAP machine, for instance, if you have sleep apnea, trying to make sure the mask is very tight.
Okay.
You can eat foods that are rich in omega-3s. Such as you could take fish oils or flaxseed oil, eat fish such as salmon, mackerel, tuna, or trout. Walnuts are good.
Okay.
A lot of practical things, including even lowering your computer screen. If you lower it to just below your eye level, it helps to keep your eyes a little bit more closed so you're not suffering so much.
That makes a lot of sense, instead of looking up with wide eyes and all. We're seeing this photo of somebody taking some drops, and is this one of the major treatments? We talked before we went on. You've seen the ads for a couple years now for Restasis. Tell us a little bit about that, and is that indeed one of the treatments?
Restasis is a very good treatment for dry eyes. It's actually cyclosporin, and it's used to increase the production of your tears as well as to decrease the overall inflammatory component. That's a very effective treatment. I usually start in a stepwise approach, though. I look at the patient, I try to determine what is causing the dry eyes, because there's different aspects of it. And then I usually start with a lubricating eye drop that are available over the counter. And I don't suggest getting those drops that say gets the red out of your eyes, because those tend to irritate the eyes.
Right.
But the regular artificial tears, and then there's gel tears, and lubricating eye ointments in a stepwise fashion in terms of the thickness of the drop in order to lubricate the eyes. Restasis is a prescription product, which I will prescribe if the other tears are not adequate. There's also a treatment called punctal plugs, where we can put little inserts into the tear ducts in order to act as a dam to increase the amount of tears just staying on your eyes. And that's also a very effective treatment. So the combination is helpful.
Is this something that once you have this treatment that it will go away? Or is it something that if you're taking these drops, the patient will have to continue on for years to come?
Well, dry eye disease is a chronic process.
Okay.
So usually if you start the eye drops and you feel better, a lot of people will stop the drops, and then a couple months later they'll come back with the same thing.
Okay.
So I would suggest using those tears regularly, maybe 1 to 4 times a day, and get in that habit if you have the dry eyes. And I would just continue with it and not stop it, because it tends to be a chronic process.
Okay, and here we got a slide of exactly what you were talking about, the punctal plugs. I don't know if I pronounced that right.
Yeah.
But you actually put something around, this is it right here, you put around the tear duct.
Yeah, so you have, every eye has two tear ducts, one in your upper eyelid and one in your lower eyelid, right where near the side of your nose. And so we just put them in those tear ducts to prevent them from draining down into your nose, basically.
Okay. All right. Well, if you feel you may have this, or you want to just have your eyes checked out for any other reasons, give Dr. Salib a call at 770-1322, the Orange County Eye Institute. You can go ahead online there and check that out. We have the website information there. Thank you very much. And this is something that I've heard about before. You see the ads, but I always thought it was just a temporary thing. You take something for treatment for a few weeks, and then it goes away, and it may come back a year later. But this is something that's ongoing. You have to take care of.
Exactly. It affects a lot of people.
All right. Well, thank you very much. Well, once again, you can go ahead and give Dr. Salib a call. There's a different one number here, but here's another number, 380-EYES, Orange County Eye Institute, OCEyeinstitute.com for more information and set up an appointment. Doctor, thank you very much. Good to see you again.
Nice seeing you too. Thank you.
All right. We'll be right back with Juan Chain from Third Mutual.